public health! Save public health! Save public health!
I'm a third-year medical student at Indiana University School of Medicine. I'm here on behalf of myself to protest the meeting between Governor Braun and RFK Jr. Law requires emergency rooms and hospitals to treat people in life or death situations regardless of their ability to pay. Now, currently, people who come in who are uninsured, they get enrolled in the state Medicaid program, and the hospitals recoup some of the costs that they incur when they treat these people.
Save public health! Save public health! Save
If we cut Medicaid, those people are still going to come to the emergency room. Your premium's going to go up because they're cutting Medicaid. And that connection is not being made, and it's not being honest.
Today's 9 executive orders reflect a new approach to health policy in the state of Indiana.
HFI funds, Health First Indiana, that came from a commission of Governor Holcomb. Now we're going to destroy that program and call it something else? No, let's build what we've got and continue to support public health in this state.
Live a healthier, happier, longer life, and today is where we begin.
Specifically working with pregnant moms and babies, I am horrified by the cuts of RFK. I'm horrified by the quack science.
Well, I would say that CDC in this case has done a very good job at controlling the measles outbreak. We've had about under 700 cases nationally. Healthy children should not die of measles, and there's no reason they should. If the doctors know how to treat at the hospital, that will not happen.
If I was in the room today, I would say, why are we destroying a public health system that's been built over generations? It's because of public health that we have longer lives now. We cannot just turn around and say, let's destroy everything we've built.
The number one line item in the state of Indiana, as it is in almost every state, is Medicaid.
Designed to get people to look away from the real issues that people are facing, such as drastic cuts to Medicaid that are currently happening in the state of Indiana.
There's a lot of other things you spend money on, but it's the fastest growing as well. And that's the part that's most concerning.
And the whole Make America Healthy Again concept is a ruse, and it's totally fake. If they were serious about it, they would be funding these programs, not cutting them.
And if it's doubling, as it has, I am told, in the last 4 years, then it's not a sustainable program. It's one that desperately needs to be saved and strengthened.
Save public health! Save public health! Save public health! Save public health! Save public health!
Before the measles vaccine was introduced, there was 500,000 people who got measles, as many as 2 million a year. And nobody got in the newspapers for them, for that. But the death rate was about 400 people a year, mainly children who were malnourished.
RFK Jr. being put in this position is just a slap in the face to all medical professionals.
Infection fatality rate of 1 in 1,200 to 1 in 10,000.
He doesn't believe in science, and it's just deplorable that he is in a position of such power.
And people don't trust our agency anymore. You know, the agency, the trust of the agency is at a historic nadir, and the way to make it trustworthy and the way to make people to improve vaccination is to make the agency trustworthy. And that's what we're going to do.
Measles have made their way here. So I would beg, as you reveal your Make Indiana Healthy Again plan, that would include Medicaid, Medicare, vaccines, protect our medical students who, there are several of them here who are concerned about their futures. We have a shortage of doctors. There are a lot of issues here.
This is what democracy looks like. This is what democracy looks like. Public health looks like. This is what public health looks like.
People get measles because they don't vaccinate. They get measles because the vaccine wanes. The vaccines wane about 4.8% per year.
As the immediate past president of the Indiana Public Health Association, I beg our legislators to realize what they're doing to destroy a system that still needs to be built up even more.
Now, my position as administrator of CMS is helping to ensure that the nation's health insurance programs create the right incentives, empower the right people.
They don't follow evidence-based science, and it's dangerous.
It's a leaky vaccine, and that problem is always going to be around.
We know how science works. We know how medicine works. We're not stupid. And in particular, let's go back to using vaccines.
Now, our nation is too great for small ideas. And the ideas that Secretary Kennedy and President Trump are putting forth in rapid fire and now supported at this level of intensity in the state of Indiana are emblematic of the fact that we have a generational opportunity to make this country as healthy as it should be.
How does a TV doctor, who's not a real doctor, make us healthy?
Actually, he is a real doctor.
Okay, he has a medical degree. However, he has spent the past 20 years selling supplements online.
And I want to thank Governor Braun and his staff for so thoughtfully crafting these in support of President Trump and Secretary Kennedy's commitment to the American people that we will make this great nation healthy again.
Both of those gentlemen should lose their jobs because they are unqualified.
And you preach that vaccines are dangerous, you are endangering our children.
New autism numbers, they've again gone up dramatically just in 2 years.
My daughter's got autism because of vaccines, so I don't want to hear, but you know what, I love you, but don't tell me what I've seen. Don't tell me what I've seen. My best friend's son has autism and it's not caused by vaccines. But you know what, we can just talk.
That has been disproven over and over.
No, it's not been disproven.
Yes,
well, obviously, her belief is that autism was caused by the vaccine her daughter received. I can't discount her lived experience, but I can look at data and evidence and clinical science, and I can say that I don't agree with her beliefs, but I can't discount the fact that she has a daughter that she's now taking care of that has autism. And if we don't start listening to one another and having hard conversations, all we're doing is shouting at each other.
No, she's not crazy. She's not crazy. No, I'm a mother that now still takes care of a 34-year-old. She was fine. She was fine.
Autism is a genetic condition.
No, it's not. MMR, they have mercury. Go Google. They still have mercury. They need to take it out. Why do vaccines in Europe not have mercury and we do?
I feel bad for her. I don't want to cause somebody pain, but I also don't want them spreading misinformation to other people. But when you look at science, I want to see clinical data, I want to see evidence-based science. I don't want to see quackery. And if you can produce peer-reviewed, evidence-based clinical trial data that validates your point, I am more than willing to look at it.
You know what? That's what I'm getting with the Democrats in Greene County. We're coming together called indivisible. We're going to be a purple party. I don't want to hear about Republicans.
And I just felt like I had to be really careful what I said so that I didn't violate her trust or her experience, and yet at the same time, I maintain my own dignity and my own right to have my own beliefs.
Thanks for taking the time to chat.
And thank you for being a nurse.
Yes, thank you.
I can do that. Because people bother me.
Follow the science! Follow the science! Follow the science! Follow the science!
Now, I'm an autistic person and I have 2 autistic children. I feel really strongly that RFK Jr. is not supporting autistic people.
We're going to improve the surveillance. We're going to get the data sets from everybody we can. We're going to do data sharing agreements with scientists all over the world, with the best scientists, and we're going to find out what contribution vaccines and everything else.
I think we understand that autism is primarily genetic, and I think we know there are environmental triggers, and I think it's not in good faith to keep pursuing the MMR causes autism.
Mold, EMF, food, all of these other exposures that began in the late 1980s. Which one of those are the culprits? I suspect we're going to see that there's a lot of culprits, but we need to know.
Governor Braun, I don't even understand Dr. Oz, what he's about. But RFK Jr. for sure, they're trying to get us from both ends. They're trying to cure autism, which an autistic person like me really doesn't like the sound of that, because that's who I am as much as I'm a woman and Caucasian. It's just part of who I am. So no, then I'm not here. And my children not here. So that's devastating to hear, because we're inconvenient. Even when we're not costing the system money, I pay in, I pay taxes. So we're trying to, it's brutal, and I think it's darker than people realize what the end game is here.
By the mid-1990s, the two biggest food companies in the world were R.J. Reynolds and Philip Morris. And they transferred thousands of scientists that were engaged in making tobacco more addictive to do the same thing with food. And they developed in the lab all of these chemicals that are unknown in nature that make food more attractive.
I'm out of Newton County, Indiana. It is a very rural area with farmland, and I am submitting soil samples here.
They realized at some point through all these, that they could hijack the human brain.
I theorize that we get more crop dusting and geoengineering spraying in this rural area rather than public cities.
And they changed our food system in this country, so it is poison to us.
I took a soil sample to Element Labs in Fort Wayne, Indiana, and it shows that our toxicity levels are about 5,000 times safe for biological creatures.
We now have the sickest country in the world. We spend 2 to 3 times for health care what other countries spend.
Our air and our soil is the most important for human health. We should have Medicaid and other causes as well, but we have to stop geoengineering if there are toxic levels in our soil, and it can affect future generations, not only our own.
President Trump, who I'm very, very grateful for, because he's given me this opportunity and given Dr. Oz this opportunity, he often says that he wants to make America strong again. But we can't be a strong nation if we're not a strong people. He says that he wants to restore the American dream, but a healthy person has 1,000 dreams, and a sick person only has one. And today, 60% of the people in this country have only one dream.
Hands off our vaccine. Follow the science.
How we pay for health care and how we eat is driven by perverse incentives. And what Dr. Oz and I are trying to do is to identify those perverse incentives, and we're getting a lot of help from Elon, and then eliminating them so that we can realign medical choices, both individual and institutional medical choices, with public health. And it's not aligned. It's totally misaligned today.
Get off social media, follow the science, believe the experts.
But we're getting tremendous help from the governors, from the grassroots. You see all these warrior moms here today. They don't want to take this anymore. They want to change. There's a huge, huge movement to get a change. And then we have extraordinary leaders like Governor Braun who are doing this on a state level, and that helps us extraordinarily. I met with the big food titans a couple of weeks ago, and they weren't scared of me. They were scared of what's happening in the states. They don't want a patchwork of regulations where one state bans dyes and one state bans bromades and one state bans titanium dioxide in the food, and now they don't know how to market a national product. What's happening here in the States is driving this movement, and it's going to drive the kind of cultural change that you're talking about.
Thank you so much.